Hello everyone and welcome to the OncoAlert Weekly Roundup. I'm your host Gil Morgan, bringing you the latest and most impactful updates in oncology from this past week. This week, the overarching theme is personalization in cancer care. Whether it's tailoring imaging and surveillance strategies, harnessing circulating tumor DNA to guide adjuvant therapy, or leveraging immunotherapy and vaccines in minimal residual disease settings, the trend is clear. Precision is no longer just a goal, it's becoming a standard. Reminding you that these are just some of our picks, and for a deeper view, we encourage you to sign up for our weekly newsletter at www.oncoalert360.com or through the QR code or link below. That's www.oncoalert360.com. Now let's dive into the key studies by tumor type. Starting with metastatic breast cancer, a global survey in the breast by Matos and colleagues highlighted a striking gap between patient preference and physician practice regarding brain imaging. While most clinicians selectively order brain imaging, many patients, especially younger or hormone receptor negative individuals, want routine imaging and more information on brain metastasis. The takeaway? Patient preferences are pushing us towards a more proactive, patient-centered approach. Also in breast, in HR-positive, HER2-negative metastatic breast cancer, a consortium study on ctDNA after progression on CDK4/6 inhibitors identified frequent alterations in PIK3CA, ESR1, and TP53 with PTEN, TP53, and CCDN1 mutations. This is associated with poorer survival. This reinforces the value of genomic profiling to guide second-line therapy decisions. Lastly, regional nodal irradiation in sentinel node positive early-stage breast cancer remains variable across experts. While high and low-risk scenarios are handled consistently, intermediate-risk cases show substantial heterogeneity, emphasizing the need for clear standardized guidelines. We turn now to bladder cancer and news from industry. The Phase 3 IMvigor011 trial demonstrated that ctDNA-positive patients with muscle-invasive disease benefit from adjuvant atezolizumab with improved disease-free and overall survival. Coupled with 2024 advances like intravesical TAR-200 delivery, perioperative durvalumab, and the enfortumab vedotin plus pembrolizumab combination, these findings highlight how molecular-guided immunotherapy is transforming bladder cancer management. And in GI cancer, in pancreatic and colorectal cancer, the Phase 1 AMPLIFY201 trial showed that the lymph node-targeted mKRAS-specific ELI-0022P vaccine generates strong persistent T-cell responses and antigen spreading correlating with improved survival in patients with minimal residual disease. And in rectal cancer, management is shifting towards total neoadjuvant treatment to maximize local regional control and survival. At the same time, strategies like watch and wait, selective omission of radiotherapy, and immunotherapy in dMMR-MSI tumors aim to preserve quality of life, marking a clear move towards precision patient-centered care. In non-small cell lung cancer, the SAVANNAH study reports promising activity in savolitinib plus osimertinib in GFR-mutated patients with MET-driven resistance. The combination was particularly effective in patients with high MET expression or amplification. Meanwhile, our review in GITC reminds us that mutations in KAP1, SMARCA4, and PTEN drive immunotherapy resistance by shaping an immune-evasive tumor microenvironment, underlining the need for precision strategies to overcome these barriers. In GU oncology and prostate cancer, MRI-led activity surveillance confirmed that baseline MRI visibility and secondary Gleason pattern 4 predict progression, reinforcing MRI's role in personalized risk stratification. And in gynecologic cancers, coexistent endometrial and ovarian carcinomas classified as FIGO 1A3 show very low recurrence risk. And finally, AI continues to show transformative potential across the oncology care continuum, from risk assessment and early detection to personalized therapy and survivor management. But successful implementation requires rigorous validation, bias mitigation, data security, and collaboration to complement clinical expertise. That's it for these week's roundups across tumor types. The message is clear: personalization, guided by molecular insights, imaging, and innovative technologies, is reshaping cancer care. I'm Gil Morgan, and you've been listening to the OncoAlert Weekly Roundup. Stay informed, stay precise, and we'll see you next week.